And so for this episode, I'd like to welcome to the podcast, Mohammed Kadir.
Thanks for having me on, man.
How do you see interests that you've developed in medicine and related to the medical field show up so far in like your journey through medicine?
But just learning from it, just seeing how everything worked, it just like really inspired me. Just look at the genuine precision, just how this mass of just like organs and sinew and blood and all that.
So I know one of the things you spoke about a little bit earlier was some of the different aspects of like definitely like community health and even.
Right. So just there in that short example, we have a policy issue, you have a cultural issue in which people don't know how to cook with that food. In order to really understand the problem, you have to be in the thick of it.
Hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I have a really fun interview that I'm very excited to get into. And before we start this episode, just want to let everyone know, if you're watching this episode on YouTube, make sure to hit subscribe, notifications, hit the like button, share it with someone else if you enjoyed it. If you're listening on any other streaming platforms, be sure to give it a follow. And with that being said, let's get into the episode. So the person that I'm interviewing today, he is a current first-year medical student at the Community School of Medicine. He holds a BS degree in biomedical sciences. He currently does neuroscience research at Mount Sinai, and he is actually an aspiring pediatric intensivist or neurologist. And so for this episode, I'd like to welcome to the podcast, Mohammed Kadir.
Thanks for having me on, man.
All right. So thanks, for coming onto the podcast. I'm really excited to get to have this conversation with you. So to just start things off, I know I gave a bit of an introduction, but could you give everybody listening an introduction into who you are?
Yeah, so my name is Mohammed Kadir. I'm a first-year medical student at the Community School of Medicine, rising M2. I predominantly do a lot of research in neuroscience. I've done quite a bit at City College with both the Common Lab and the Kim Lab, and now I'm moving on to different avenues, and we're moving to Mount Sinai to conduct some research there over the summer and hopefully over the next few years.
That's a lot of things right there that I got to ask you about. But first of all, you mentioned all the stuff that you're getting into now, especially in terms of neuroscience, all of those things. So if we just start even at the beginning, what got you onto this path of medicine in the first place and pursuing becoming a physician?
Well, I think a lot of first-generation students have a similar drive, and it's in the fact that my parents were immigrants and they never had an education. They grew up in a war-torn country, grew up in famine, and they didn't really have much. So my drive really came, how can I support my family? How can I give back more than I'm taking? As for medicine in particular, the inciting event happened with my sister when she was tossed into the ICU after a really bad case of pneumonia and a seizure. So seeing the fantastic work that the MDs and the physicians are doing, along with the other healthcare staff, really did inspire me to look into medicine. Now, of course, everyone has their selfless endeavors, but truly there are some selfishness involved. I think for me, it's the fascination with the sciences, understanding how the body works, understanding how what we perceive to be as simple actions, how truly complex they are, and how there's so much order in the chaos we see.
That's definitely a lot there, because number one, it's like, as you mentioned, there's like the aspect of, wanting to be able to, of course, like take care of your family and be able to, pursue a career and all of those things. And there's the aspect of being a clinician, wanting to care for patients. And then even for you, there's like also just a fascination in of itself of like the science beneath, all of that. And kind of all of those like combining together is kind of what I'm getting.
Of course, I mean, end of the day, you could self-sacrifice all you want, but you don't want to be a candle that's being burnt at both ends. There has to be some self-vested interest in what you're doing in order to make sure that's sustainable. Because as much as others have rights, our body, our own desires have a right over us that we must suffice. Or else you're just going to end up as a lifeless husk 10 years down the line.
That's interesting. That's an interesting way to word that.
Yeah, I mean, it's true, isn't it?
So I know you mentioned like a lot of things there that really contribute to like the passion that you have for medicine. And one of the things I definitely want to ask you is, how have you maybe seen a lot of your interests that you have related to the medical field kind of show up or almost kind of drive you to specifically where you're at now or throughout? At this point, you've gone through undergrad, you've gone through, you're going to your second year of med school. So how do you see a lot of the interests that you've developed in medicine and related to the medical field show up so far in like your journey through medicine?
I mean, with every organ system, a lot of those interests do come up, start to decipher how the entire body works, how it's all interconnected. With each subject, there's entire PhDs, dissertations written on it, hundreds of them. This is just understanding like these simple concepts. Like, I'll give you an example. Let's take the cardiac system.
Mm-hmm. Yeah.
But just learning from it, just seeing how everything worked, it just like really inspired me. Just look at the genuine precision, how this mass of just like organs and sinew and blood and all that came together to form something that's so marvelous and so precise. So as I'm going through each organ system, as I'm going through each topic, let's say, I'm really seeing a lot of my interests come to fruition. Nothing essentially particular, but just seeing how everything works together is something that I find fascinating.
Yeah, no, I can definitely relate to that. I think that's probably always been one of the most, if not the most fascinating thing about, studying medicine and learning medicine, at least to me, has definitely been seeing just how all of that stuff just kind of like intricately works together and then ultimately allows for like the human function and stuff that we kind of just like take for granted every day. Like, we don't even like give a second thought about it usually. And then like actually understanding like all the underlying science behind that, I think is a pretty incredible thing for sure.
Precisely. I mean, what's the saying that you don't know what you have until you lose it, right? So I mean, the sick relate to that the most often, but us as physicians should also too. Think about how complex a simple action such as a sight is, right? The amount of neurons that are firing off the separate receptors, your eyes as an organ itself, right? Yeah. All this complexity coming together to do a simple action. Every time we take a breath, that in itself is a complex action. So literally, you cannot count all the actions that we're doing. How fascinating that is, how we don't even have to think about it and it's being done.
Yeah, for sure. So you mentioned, even just like, you just said right there, like you mentioned sort of all the different things that, you're able to learn and you've been able to learn throughout your journey through medical school thus far. And thinking about all the material that you've learned up to the point you've gotten to now and all the different science and underlying pathophysiology and all the different stuff you've had to learn, memorize, apply, would you say, given the limited amount of experience you've had in med school so far, that you find material in med school being like, would you look at it as something that's like too difficult to manage, or how do you kind of look at how you've been able to handle, the rigor that comes with medical school? I
mean, you and I both go to the gym, but it's just like lifting any weight. You put on 2 plates, you put on 3 plates, whatever have you, and you're pressing that up. The exercise never really gets easy, does it? Right? But you know how to tackle it. You know how to improve. And that's exactly what medical school is. At the end of the day, the material is still difficult. When the physio comes around, it takes you like a day to really sit down and grind through it all, right? So it's not necessarily that it's easy per se, but there's definitely a method behind the madness. And quite frankly, it's not rocket science. There are some complex topics, undoubtedly. But the majority of the topics you can understand, you can really memorize and put to memory and put to heart. So it's not necessarily that it's hard, but more so it just requires hours. And the better your plan is, the better your approach is, the easier time you have.
Yeah, no, I can definitely say I relate to that for sure. And it's especially when it comes to like that planning aspect for sure. I think that's been like huge for me. I think in my medical journey so far is like being able to stick to a plan in terms of like how I'm able to handle the amount of material that comes at me. I find that I'm able to do it, not necessarily maybe with ease. That's probably not the best way to put it, but I'm definitely able to handle it very well. Partially because of that, for sure. And I kind of going a little bit off of that point. Obviously, you probably wouldn't say like every aspect of your life is just like being a medical student. But in terms of all the stuff you mentioned with medical school, and then also recognizing the different aspects of your life outside of medical school, how have you been able to kind of balance and kind of make those different things work together?
Like you just mentioned before, it's all about scheduling and figuring out how to organize things, right? You only have so many hours in the day. You got 24 hours, and about a third of it, you should be sleeping, right? The
Yeah.
keyword is should, not necessarily mean you are going to be sleeping. So I think the general advice is make sure you get your sleep. But let's say you have 16 hours left. What do you do with that time? Of course, you're going to dedicate 4 to 5 hours to studying, and if you're consistent with it, that's all you'll need.
Yeah.
You never really need to spend double-digit hours studying, right? So you spend your 4 to 5 hours studying, right? Then what do you do with the rest of your time? You'd be surprised how much time we really put into our phones, into our games, and all that. When you wake up in the morning and you're rolling over, the first thing you grab is your phone to scroll through Instagram. That could be 30 minutes right there. And yes, that 30 minutes in the grand scheme of things, it may seem insignificant, but all that adds up. So always have a plan ready to go. And it may seem arduous, but you'll see at the end of the day, you could fit everything in, you know. So look, let's go back to that example. 4 to 5 hours studying. That leaves you with 11 hours left with the day. What do? Of course, physical health is essential. Spend about an hour, 2 hours exercising. Let's go with the larger extent. Let's say 2 hours. You're down to 9 hours left. That's still a lot of time to do stuff. Go do something else. Maybe go speak with friends. Go have time with family. Go build a new hobby. You know, like you're doing in the podcast, right? You have to put in a lot of time to do it. But really, it all comes down to this consistency and scheduling, right? Because if you don't have either of those things, you'll find yourself spiraling out of control and cramming 2 weeks before an exam, spending literally 15, 16 hours studying. There's no point in doing that.
Yeah. No, that's definitely an interesting point to throw in there too, because I think what that kind of gets at is, I think sometimes, and that probably goes for like everybody, like we don't always recognize how much time that we have at our disposal to use toward different things. And I think there's probably a good amount of time throughout the day where we kind of like let waste, you know, or kind of end up just kind of letting it fly by us as opposed to maybe making the most out of the time,
Right.
you know, that are available.
Sure.
I know you talk quite a lot about like perhaps your professional life in the sense of like as a medical student. We've talked a good amount about, you know, maybe different like study tactics and different study tools, and I think that's always going to be helpful to anybody listening, you know, that sort of thing, especially who's considering something like, you know, the medical path. Outside of those things, what would you say? Because I know a lot of the conversations I'm able to have with people, you know, you've often been able to, you know, talk a decent amount about kind of like maybe their own background and the different things, maybe even at times that didn't even seem to have to do with medicine that kind of pushed them more towards like the medical path, or, you know, inspire their interest in medicine, the different career goals they have in the future. Is there anything that you can think of particularly that, you know, maybe you haven't mentioned already that you notice, you know, has maybe either like built, you know, your interest in medicine, or maybe build some of like the goals that you're aspiring towards like far in the future?
Yes. Of course, I think the two things that I could really think about right now is the community that I grew up in, and the fact of the matter is that I'm an older brother to many of my cousins. Right? So let's talk about my community first. And I grew up in East New York, in Brooklyn, a pretty impoverished community, and it's very, very much not affluent. And when you go there and you see the drug abuse, you see how most of the children are running around outside without parental supervision, and you see how decrepit the city is, you really want to go out there and help these people. Right? End of the day, most of these people are just born into this situation, right? And some of them are just so driven by their external factors that it's hard to really escape it all. So when you grow up in that community and you see all your friends and all your quote unquote family like go through all this stuff, you want to really go out there and help them. And the second point is that I have at this point over two dozen younger cousins, right? We're a big family. And wow. I grew up as the older brother. I grew up helping them, making sure that they're okay. And I think that need to be helpful really comes from that upraising. You know, what our ambitions, our goals, our values really comes from how we were raised. And because I was raised in that nurturing role, I want to return that nurture not only to my family, but to my community
Hmm.
and to the greater population as a whole in one way, shape, or form.
Yeah.
You know?
No, yeah, I think it's definitely key, because I think what they're kind of getting at there is like how, I think number one, just that environmental aspect of like knowing what the people around you have had to go through and wanting to be able to kind of give back and improve communities in that sort of way.
Right.
And then that probably showing up professionally, and then also the aspect of you kind of being in that nurturing role, which is one of the things that, ultimately a lot of physicians are going to need to be able to do to really make an impact for a lot of patients' lives.
For sure. I mean, end of the day, you're not going in for money or for anything, right? You really can't.
Yeah.
You definitely won't be.
No.
So if you're going to choose this route, look, you really can't. You only have one option at this point, because even the prestige aspect is going down. No one respects doctors as they used to respect doctors, right? The only thing at this point is your desire to help others that's left.
Yeah, no, I definitely think that's crucial there. So, going off of that, so I know I mentioned earlier with the introduction, I think you mentioned as well some of your interests in terms of what exactly you want to do in a career in medicine. Could you maybe expand a little bit more on that?
Right. So I think right now, like I mentioned with the entire family situation, pediatric is something I'm interested in simply because I like working with kids. But when it comes down to my subspecialties, because I can't really find myself being a primary care physician, I see myself craving something more. And so I've decided to go either to neurology or to intensive care. The reason why I was considering neurology is because, well, the brain is the forefront of all discovery at this point. As much as we know about all these other organs, the brain is still the most perplexing organ we have. We still haven't been able to figure out the answer to the question about consciousness. And we've had all these technological revolutions, right? We still can't figure out the exact processes that are going on, what cells are working where, what receptors are working where, et cetera, et cetera. So I think neurology itself is something I find fascinating, especially when we talk about treatment of pathologies, because we really don't have a precise tool just yet. Right? Our toolbox is pretty small compared to all other organ systems. Now, why intensive care? Well, because that's your opportunity to make one of the greatest impacts you can. Treating a cold, treating a tummy ache, of course it helps someone. But what happens if they're septic? What happens if they have kidney failure? If they have fulminant hepatitis? So all that type of stuff, like, you deal with those patients in the ICU. You deal with the worst of the worst. And the opportunity to help them and to either give them better quality of life or even help them recover, now that's something that's gold. And overall, I think, other than medicine as a whole, I might even consider going down with research. I mean, just because, like, there's just that natural inclination to know why, right? Why does this occur? And if you're given the opportunity to have such a level of education, why not ask the question? Why not chase what you wonder? And provide information for everyone else to use, everyone else to develop. No technology was developed by a single person. It's developed by a community of thinkers.
Yeah. I think that's definitely a really good point there. I think in terms of even I don't even know if I've thought of like ICU and like pediatric ICU medicine and stuff like that in that sort of way. Because it does seem like very, very like plain and simple, but I think like that's a really good point to be able to make there, that ultimately there's probably, and granted, of course, a lot of different specialties are going to make, enormous impacts in different areas. But I think what ICU medicine provides is definitely something that's probably unique in that sense, quite a bit.
Yeah, for sure. I mean, you're not going to be dealing with that as a primary care physician. At least I don't think so.
Yeah.
Most of the time. Worst case scenario comes in, you're on the clock,
Yeah.
So you got to do the best you can. And it's something that's a unique experience. High burnout rate, of course, but the work had to be satisfying for these people to go into it.
So I know one of the things you spoke about a little bit earlier was some of the different aspects of like definitely like community health, and even some of like the different that socioeconomic factors and different things like that, and environmental factors that often affect a lot of people. And obviously a lot of those things often affect patient care and healthcare and wellness on a large scale. How do you envision, or maybe what are maybe, I guess, let me ask this. So do you see any sort of challenges to making an improvement when it comes to community health, especially from that angle? And how do you maybe see that improving?
A lot of it's going to be extremely challenging, of course. End of the day, the patient's going to be spending 99% of their time out of the office. It's just the nature of the matter. So the only way we could really make a substantial impact on patient health outcomes is by altering what's going on in the community, right? Now that poses a lot of challenges from many different aspects, from political to social to cultural. You're going to be tackling a lot of different issues all at once, right? And it's not just one-sided. I know oftentimes we just see policy this, policy that. Policy can only go so far, and it's about really reaching into the hearts of the people and altering what they believe, right, in order for their own benefit. And that's controversial, it's difficult, and it's going to be rife with challenges, right? So let's take a situation, let's talk about food, right? As we know, last century we exchanged viral and pathogenic causes of death, right, to more chronic illnesses. Right? So when people were dying from bacterial illnesses 100 years ago, that's a lot less common, but it's more common to die from diabetes or coronary heart disease, et cetera, et cetera.
Yeah.
Food is at the center of that. And at least is one of the major factors.
Yeah.
Let's take one in my community, for example. It's a food desert. It's not a supermarket for about 2-mile radius. It's very far and few in between. Even if we made policy in which we increase the number of supermarkets and we reduce the cost, how many people are going to utilize it? And even if they utilize it, how do they know what to cook and what not to cook, what to eat and what to avoid, right? So just there in that short example, we had a policy issue, which will take decades, in my opinion, to really rectify, right? You have a cultural issue in which people don't know how to cook with that food. For example, when we recommend eating a Mediterranean diet, how many people are from the Mediterranean know how to cook that specific diet or make it palatable, right? How many people are more likely to stay to their own people's diet, right? America is a cosmopolitan society. You're having people come from all walks of life, all different cultures. Yeah. They're going to stick to their own food. I personally like my curry and my rice. And it's horrible for your blood sugar. But how difficult would it be to alter a patient from that diet? And then finally, it's also about education.
Yeah.
We really don't know how to manage patient education, quite frankly.
Yeah.
Right, think about it like this. You go to a doctor's office. Your average American is having, I believe, is third grade level reading level, right? Let's say third, fourth grade. So elementary school, right?
Yeah.
How are you going to explain hemoglobin A1C to them? How are you going to explain hypertension?
Yeah.
Oh, you're sick, but you feel fine. How do I, but I feel fine. Well, how am I sick? Why do I need to take medication? How do you answer these questions? And even if you're able to answer them, how do you tell them, hey, even though rice doesn't have sugar in it, it still has a lot of sugar, So it's like there's so many, all these questions and all these different factors contributing to the bigger issue. Making a change in the community, it's a long endeavor. Yeah. Right? It requires us to build rapport, to be in the communities. You can't be outside trying to fix a problem inside. You have to be inside.
Yeah. No, that's definitely really that's a lot of interesting stuff right there for sure. Because I think what that shows is like it's a very holistic sort of approach, or it's a very holistic sort of issue that's not necessarily a sort of easily clean cut, one size fits all sort of thing all the time. But that, like, I guess if I'm getting at what you're getting at correctly, that there's a lot of different aspects that have to be considered on. You're not only the policy aspect, but you're also talking the patient education aspect. You're also talking about how to actually not, because you can't, I guess, only like you said, like you can't just try to fix issues in a community just from the outside perspective, but like you actually got to be willing to work with a particular community and help the specific concerns that a community is going to have there.
Precisely. Look, end of the day, we all sit in these comfy college classrooms with the AC blasting, coffee in hand, and we act like we could solve the entire world's problem. In order to really understand the problem, you have to be in the thick of it. You got to get your hands dirty. If you want to help these communities, work in the communities. Do you think these doctors in the big hospitals really help the community? Is it really the local physicians who open up a clinic and are willing to see their patients for 20 minutes, half an hour, to really get to know them that are making the difference? Yeah, of course it's nice, being able to sit back and just comment on the issue without really tackling it. But if you really want to embody what we speak about, what we say, right, then you're gonna have to get in there and get dirty, and that's inevitable.
Yeah. So what are maybe some of like the practical ways you could see that aspect of the issue, being solved or seeing more improvement in that area?
For sure. I mean, like right now, majority of us can't do anything, right?
Yeah.
That's just given. Look at us. We're 20 some odd year olds. We don't have an income. We're still learning. We're still in school. Bide your time. You don't need to attack at every single moment. Sometimes it's good to be on the defense. At least sit back a little bit. For now, focus on what you're doing. Keep your goals in mind. Do not let yourself get lost in everything that's going on. It's easy to get lost in medicine, right? Your goals could switch. Maybe you want to have that nice life. It's very tempting, extremely tempting, right? And finally, go out there and spend some time with the community. Don't stay home all the time. Yeah, it's nice having alone time. Yeah, it's nice just being home studying. But like we said, manage your time. And if you do manage your time efficiently, spend an hour or two. Go help out the community. Maybe go tutor some kids for free. Maybe go to a food pantry. Do whatever you need to do, but get to know your community. Because that's the only way you could solve a problem. First, we got to identify the problem. And how are you going to identify it if you're never really there?
Yeah. No, that's good. That's good. Because I think what that kind of keeps coming back to is it's going to be difficult to solve a problem if no one's actually going to be there to really be in the thick of it and make change there.
Exactly.
So, yeah. No, that's
I would
good.
even go so far to say you can't make change if you're not in the thick of it. It's not just about having a few people there. It requires everyone to really be all hands on deck.
Yeah. As going off of that, making a bit of a pivot, I do want to ask you really just a couple last few things. So what would you say are a lot of your long-term aspirations in the future? Let's say, after, getting an MD and becoming a physician.
Sure. I think I want to continue my career in research. Maybe look further into developmental disorders, neurological developmental disorders. We have plenty of work to do in research still. Plenty of things to explore, and that's something that fascinates me. I think as for medicine as itself, I think I'd want to eventually open up a few practices in order to, like I said, reach out to these communities, really expand my reach, and make sure that I could help as many as I can, while also ensuring that my family is safe and making sure that they're provided for. Like I said, I have a large family. I'm the oldest of the bunch. It's something that I want to make sure that my family doesn't have to struggle any more than they already have struggled. And finally, for me, I think I might want to go down into a career of teaching. Something that I find fascinating, being able to shape new minds and be able to help everyone out. We've done that here with our undergraduate students, where we go to the anatomy lab and we go help them out, or even our own peers, where we sit down and really spend a few hours trying to explain topics. But it's something I find extremely rewarding, because even though I'm not benefiting, seeing someone else benefit is something that I find rewarding.
Yeah. And going off of that part also, as you mentioned, like pouring into basically people coming after you, because I try to definitely always make room to be able to, through the podcast, speak to a lot of people that are aspiring physicians, that are maybe pre-meds, maybe they're in high school, maybe they're in medical school right now, and be able to kind of give them information, advice, inspire people, things like that. If there was one piece of advice that you could leave to people that are aspiring to be on the medical path, what would it be?
Never forget why you went into it. It's easy to get lost, easy to lose track of time. It still feels like it was yesterday that we started, How many hours are we spending studying? How many hours are we spending just work, And we're also working on the side, right? We're working for salary. We're working to make sure that we're stable, right? It's easy to lose why you're becoming a physician. So always have that reason why in the back of your mind, some card that you pull out and be like, this is why I'm doing it. Because sometimes you really do forget why you're doing it. And it's easy to fall into that trap of selfishness and just striving to do this noble deed for your own self-gain. So by having that, you're able to not only keep pushing forward, push past the hard days, right? But it also pushes you in the right direction.
Yeah.
So, yeah.
All right. Yeah, so I think that pretty much wraps everything, I wanted to ask about. I definitely thought that was really interesting for sure. I felt like, I was able to get to hear your perspective on a lot of stuff, and I've definitely felt like I learned quite a bit. And I'm sure a lot of people listening to this podcast episode definitely felt like they were able to learn quite a bit and, be able to hear, your perspective on a lot of different stuff. And so definitely appreciate you coming onto the podcast, having this conversation.
Yeah.
I always forget to ask people I interview this. Should probably ask you this. So, is there anywhere people can find you or anything you want to put out? Or?
I mean, I do have my email, so just feel free to reach out to my email. You want me to say it out loud?
You go ahead.
It's like any other city email that we have, right? You can do mkadir000@citymail.cuny.edu. If you have any questions, just toss them my way, and then I'll take a look when I get a chance.
All right. So then in that case, that really wraps up this episode. I'm glad to everyone who tuned in and listened all the way at this point as well. And I'll see you in the next one.